Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hi, I'm Dr. Renuka Prasad here, Managing Director and Consultant for New Diacare Center and Polyclinic, Mysore. Today, let us have a small discussion or talk on hypertension.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
The hypertension is one of the most commonest non-communicable disorder in our community. So we know that these non-communicable disorders causing a lot of health issues in our community without actually having a knowledge of having it. So keeping this in mind, hypertension is most important because according to the WHO, four out of 5 people are having hypertension and are treated not well. Keeping this in mind, and though people feel they are fine, if the consistent hypertension can cause damage to their organ, whether it is a heart or kidney or even the brain, definitely it causes a lot of health issues and causing a lot of mortality in our community. That's why we need to have a lot of awareness about this hypertension.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
The non-communicable disorders are behaving like a silent killer because even with a dangerously high BP, people can live without knowing that they're having the BP. But when time comes, it damages their major organs like heart, kidney, and even the brain. It can cause the heart attack or even the kidney failure or even the stroke. In the later days, it also causes the dementia or even other peripheral artery diseases. These are the most important thing to be considered when dealing with the hypertension. That's why, because as we know, more than 50% of the people, those who are having the hypertension, they don't know they are having it, and out of that, even 50% of the people who know that they've not been treated well because of they're not adhering to the treatment. They don't have much awareness about it. That's why we need to actually have the awareness and about this silent killer called hypertension.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Yes, of course, it is a lifestyle and genetic factors as well. Most of the time, we commonly see there is a primary hypertension. What we call it arises from either their lifestyle, their stress level, or even the lack of exercise or poor heat pattern. This is what we call primary hypertension. And sometimes some 5 to 10% of the people will get a secondary hypertension that may be due to some hormonal problems or even some renal issues. In that case, actually, we need to treat the causating factor, and in primary hypertension we need to try to cover what are the risk factors to certain level, and then we need to start them on medications along with some supportive measure as well.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
So in general, the people who are having the less than 120 by 80, we call it as normal. The person who is having 130 by 80 consistently or above the readings, we call it as hypertension according to the American Heart Association. So, but there are different guidelines and there are different numbers for the different age group as well. For example, the person who is having a diabetes, the person who is having a renal problems, and the person who is having a elderly age group, these numbers will differ. So in that case, we need to know your numbers from your doctors. So, and also the other associated factors as well.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
No, because we know that most of the time any non-communicable disorders, we always give a trial of lifestyle changes. most common lifestyle changes when it comes to the hypertension part is the reducing their salt intake. Instead of having more than 2 gram, I think if they cut down their even 1 gram of salt per day, it can reduce their blood pressure level at least 5 millimeter of mercury. The same way, if they continue to have the regular exercise at least 30 minutes in a day, 5 days in a week, that would be help them. And also having a high rich or the diet rich in the green vegetables, fruits, that also what we call dash diet, that will also improve their actually hypertension by providing a lot of antioxidants, and also most importantly reducing the stress factors. And of course, if they're having any health issues, actually we need to deal with that accordingly by keeping all these. And also if they're obese, by reducing their 5 to 10% of weight loss, we can also minimize the risk of getting to the next level. So keeping this supportive measure by quitting alcohol or even the smoking or having a good healthy habit, that definitely they minimize their actually lifestyle and improve their blood pressure level, and some people may not even require the medication at that point.
Can we say that hypertension can be treated without medication?
No, definitely in the many cases it's possible. As I already mentioned, these life supportive measures, like for example, following a proper healthy diet, that is heart friendly diet, or minimizing their weight actually, and having a regular exercise on regular basis, whether it is aerobic exercise or muscle strength exercise, whatever, and reducing their salt intake. And if they consistently following this type of lifestyle pattern, definitely we can treat them without medications. But sometimes, for example, I already mentioned secondary hypertension, there definitely we need a treatment. In primary hypertension, gradually as the age progresses, they may require, in most of the what we are seeing in our day-to-day OPD, more than 60% of the people in the coming days, they may require the medication.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Considering the previous question, the same thing. If they follow the lifestyle in the very thoroughly with respect to their diet, their weight, their other exercise pattern, and also the reducing the stress level, definitely they can reduce the medication to minimum level. With that, actually, when we are treating the hypertension, our goal is to minimize the number of medications, and very effective and safest dose we can provide them with the supportive care. And some cases, as I mentioned, if they're having all other medical illness, that time we need to continue for a lifetime.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
So particularly when the person is having a hypertension for the first time, that called a newly diagnosed hypertension, initially they need to take at least 2 to 3 times in a week. But later on, once they get stabilized, they can actually monthly, once or twice or once in 3 months, they can check on regular basis. But of course, they should actually check properly, because there is a proper guidelines to that. Usually we advise once in the morning, once in the evening, and using a proper cuff, measuring the BP for that particular person. And also actually they should not have any hot beverages, or they should not have a brisk walk beforehand for measuring the blood pressure. You can measure at home or even in the clinic, that doesn't matter, but we should take at least 2 to 3 reading 1 minute apart. So by considering that, we can take the highest reading of that particular person. We call it as hypertension, whether we need to adjust the dose, or even to minimize the dose, or to stop the medicines. We need to take we need to monitor the BP, and we can take a decision according to that.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
Yes, generally what we are seeing nowadays is the diabetes, one of the leading cause of actually organ failure in the most of the countries. In the similar way, hypertension is also cause the same thing. In the consistent high hypertension cause actually loss of elasticity to the blood vessels. They actually damages the inner lining of the blood vessels. During that time, actually the organ, particularly like heart, or even kidney or even the brain, it will get affected, and it particularly damages those organs and cause a lot of mortality and morbidity. So in that way, I think keeping the blood pressure under good control, we can minimize the lot of complication which occur due to uncontrolled hypertension. Not only that, the most of the time nowadays in OPD, we are seeing the people are coming with a lot of comorbids, whether it is hypertension, whether it is heart-related cardiovascular disease, or even the stroke. And in that case, we need to monitor each and every parameters to keep the blood pressure under good control. And one influences the other complications. That's why we need to consider all the non-communicable disorder at once, and we need to treat accordingly. So the 5 things, at least 4 things what I suggest in that case. The first one, know your number. That means check your BP on regular basis. The second thing, the move more, eat heart healthy diet. That means at least 30 minutes a day, your walk and your heart healthy diet can protect your hypertension. And also stick to your treatment. That means adhering to your treatment, follow your doctor advice, and without doctor actually advice, you should not stop your medicines. And of course, most important thing is diabetes, either diabetes or hypertension or any other non-communicable disorder. It is like a silent killer. Don't wait for any symptoms. It is not too late or too early to start the treatment. So please take care of yourself, take care of your numbers, whether it is your BP, whether it is your diabetes. So please consult your doctor or consult your expert. Make sure that you are healthy now. Thank you.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.